And Perry, I'm in a similar situation too. I have a 10 o'clock fire chiefs meeting that I need to pop out of. So sorry, but just the one day that's double booked. That's not usually that deal. So
yeah. Well, at least you're going to be cool, Mike. At least you're going to be cool, Mike. I'm glad.
yes, I am.
Understood. Well, how about if I start with the land acknowledgement? Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across barriers of all heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. Hi, Doug.
Good morning. I apologize for being a little late. I was on the phone with HR.
The downside of virtual meetings, there's usually 4 things and then a meeting immediately following. Jack and Mike had shared that they have conflicts in their schedules at 10 o'clock. So I will just jump in real quick and share, I think, some of the pertinent information as far as data that I've collected from the providers, Pioneer Human Services and Detox and Compass Health and the triage component for Q2. It is information and data that we do receive from the providers that we track just in terms of referrals, that sort of thing. I'll start with Pioneer Human Services, the detox component. This is April through June, Q2 of 2022. Pioneer Human Services had a 74% utilization of available beds through Q2. We arrive at that number. They have 16 beds available typically, unless there's a COVID thing, and then multiply that out by the number of days in the month, and we arrive at the maximum utilization. So they had a 74% utilization. That is the same as they had in Q1. This quarter, the second quarter, they received 778 referrals, averaging 259 referrals per month. That is actually up from Q2 by quarter. It's an increase from Q1 of 119. They are, in my opinion, doing a number of steps and pieces to actively work with referrants and make a quick admission process for detox. I just threw a couple of things in here. Again, we gather a number of different referent pieces of information. This Q2, there were 605 referrals from self and family. 106 referrals from other professionals, and Peace Health made 56 referrals. So I just chose the top 3 in terms of the number of referrals for Q2 and the detox. Compass Health for Q2, they had a 53% utilization of available beds. This is actually up from Q1. About 2% increase, and I have a little bit of information about what I hope is happening with that. They received 340 referrals during Q2, an average of 113 per month. This is actually down as far as referrals from Q1 by 42 total referrals in Q1. Compass Health, I talked about this a little bit in our last meeting. They did initiate a streamlined admission process for law enforcement and first responders. I'll go into a little bit more detail, but essentially it entails an initial call from law enforcement or first responders. There's 5 questions that are exclusionary for admission, and as long as those questions don't exclude the information, they confirm and admit by law enforcement, first responders. At that point, it drop off. And I've gotten a little bit of feedback from Deputy Bauman, actually called and just sent an email and said, hey, we had a referral that we needed to take care of, and called Compass Health, and yep, it was 3-4 questions, and we got them in, and it was great. So it was wonderful feedback from Deputy Bauman, one of our behavioral health deputies, if folks aren't aware, along with Deputy Clicks. And so that was some just great information to get back. Also, Compass Health has acquired their state certification to allow for 12-hour law enforcement holds. This is a process that we've been working on. And so they had to go through an initial piece of getting certification for that level of care via Department of Health. And they have accomplished that. I'll get into a little bit more information about that as we talk further. So that piece has occurred. As far as reference for the triage services this quarter, self and family were 165, other professionals referrals were 49, Peace Health referrals were 83 in this last quarter. We had referrals from Mobile Crisis Outreach Team, Compass Health, our DCRs, that was a total of 20 over this quarter, and law enforcement has provided 16 referrals thus far, during quarter 2. So just some basic information about utilization and referrals there. Thoughts, comments, questions about that particular piece? That's really the meat of what I can provide at this point. Yes, Jill's got her hand up.
Thanks, Perry. Are these reports produced every quarter, and are they sent out to folks? And if so, can I get on the email list for these?
You know, they aren't. And what happens is we put together a spreadsheet for the providers as part of their contract. The contract that the health department has with them is in relation to their rental for the facility. So we have, you know, kind of limited orientation in terms of their services and et cetera, but we did require that they report this information. It comes in a monthly basis, Jill, and I compile it from a month to month, and then you know, put that information together. I can forward this to you, Jill, if that would be helpful.
Yeah, the reason I'm asking is because the task force approved Stephen Gockley's data dissemination project a few months ago, and that involves collecting reports, data reports that are already being produced from various agencies around the county and making them available on the task force website. So if that's something you're comfortable with in whatever time or format, I would love to be able to do that. Thanks,
you know,
Karen.
I may be able to chat with, I will work on that, Jill, and I'll work on, actually, there's got to be a method. I am definitely not an Excel guru by any stretch of the imagination, but there has to be a fairly quick summary of quarterly as opposed to monthly that would probably be a little more helpful in that regard. But I will make a note of that and take responsibility to touch base with you and get that information.
Great. Thanks so much, Perry.
Okay, Doug?
Just to go back, you mentioned Compass now has a certification for the 12-hour involuntary holds.
Yes.
So do you know when that was effective, and do they have the staffing to be able to accomplish that at this point?
Great questions, Doug. And so I'll go into a little bit more detail of that just to hopefully answer all of these questions. I don't know the exact date of this that they got the certification, but I know it was very recently. And so let me just sort of, I actually made some notes for myself. So if I don't answer your question in this list of information, please, let's, you know, just I'll elaborate further. If folks are unaware, basically this process is connected to RCW 1031-110, alternatives to arrest. I'm always very cautious about using the word involuntary, although technically it is accurate. Although if you think about evaluation and treatment centers, ENTs that are run by Compass Health and others in the state, those are involuntary facilities, but there is a difference in this RCW and the RCW that guides those evaluation and treatment centers. A couple of the differences are that the licensure that Compass Health received in regards to our crisis stabilization center does not allow them to go hands-on with individuals. So I wanted to be really specific about that. They will certainly implement a number of processes and procedures of de-escalation and motivational interviewing and other steps to engage an individual. But essentially, RCW 1031-110, this alternatives to arrest. If I just sort of generally describe it, I can send this information to anyone that would like to have the actual RCW. Essentially, law enforcement identifies an individual that has been involved in or is conceivably or possibly arrested for a low-level crime, and that officer has the opportunity through information that's identified by the prosecutor's office in terms of which crimes to use the alternative of taking the individual to the crisis stabilization center. At that point, the individual is informed that they are required to remain at the crisis stabilization center for a minimum of a 12-hour period of time as an option of arrest. As the individual agrees to that and then it's brought to the facility, the law enforcement professional then speaks to, during the admission process, speaks to the crisis stabilization center staff, informing them, and the individual is admitted as anyone else is. Obviously, the staff work with the person, at that point to successfully complete an admission and specify to the individual that a 12-hour hold is in place. There is no specific isolation or containment that occurs at that point other than that there's an understanding that law enforcement hold is in place. From there, if the individual leaves within that 12-hour period of time, Compass Health will inform the office of the law enforcement, whoever it happened to be, that the individual did leave. If the individual remains for a minimum of that 12-hour period of time, then that process stops. The average length of stay at the triage facility is from 3 to 5 days, and certainly the staff are going to work with that individual to keep them there for that period of time. Compass Health has developed a protocol and procedure for accepting these individuals on these 12-hour holds. And I talked with Brandon Foister, as the director of services that I talked to specifically. Y'all may know him. And he said, yes, we have developed a protocol and procedure. He did clarify again to me that we can't go hands-on with an individual, but have fairly sophisticated de-escalation and motivational interviewing techniques. And they are in the process of hiring staff at this point in time, because there is some requirement. I don't have that detail at the moment, but there is some requirement of additional staff. And as folks are fairly aware, a workforce issue exists, and so they do have those staffing positions posted, and will continue to keep me informed in regard to filling those positions. The Crisis Stabilization Center, I think, as everybody here anyway is aware, is not a locked facility. And if an individual demands to leave, they make every effort to work with that individual and offer options and, and those kinds of things. But if the individual does demand to leave, eventually the staff will certainly come to a point of saying, okay, here are the consequences if it was a 12-hour law enforcement hold of you leaving, and you need to be aware of that. And they'll go through that procedure. So there was also, wanted to mention, proviso funds that legislation did put in place for supporting this process. 2022, they allotted $200,000 from the general fund, as well as 2023. This is provided in a one-time basis only for Healthcare Authority to contract through North Sound Behavioral Health Administrative Services Organization as a pilot project. And there are some reporting processes and so forth in place. Obviously, number of individuals that have been referred, number of individuals that have been retained, etc. So I will mention too that unfortunately, at least from my perspective, Brandon Foister has informed my office that he has resigned his position with Compass Health, which is a significant loss. He's been a really great partner to work with. And so I'm actually meeting with him next week to talk about who will be in place as his successor and those responsibilities. Boy, Brandon was a DCR from way back, worked in the jail, you know, did a number of different roles, and it's just super knowledgeable. So I was disappointed, you know, to hear that that he had tendered his resignation, but you know, certainly hopeful for him as far as his career, obviously. So I'll be able to gather just a little bit more information of who I'll be in contact with in regard to this change, and particularly in regard to the admission process with Compass Health, just in general, and also the 12-hour law enforcement holds. So I asked Brandon when we were meeting what he thought about actual implementation of the 12-hour law enforcement holds, Doug, and he had indicated that he would direct whomever that's going to be responsible to update me on a monthly basis. They aren't in place at this point, but they are posting those positions, and look forward to interviewing for the positions for full implementation. So you will be one of my first calls as that process comes online.
I appreciate that. And like I said, I know early on there was, you know, I think the understanding from law enforcement is this would be another opportunity when people were taken into protective custody. ER is not always, there's a long line. So between EMS, fire, and law enforcement, another alternative for, you know, people in protective custody, taking them somewhere. And with this 12-hour hold, it's a little different, and it's certainly not, like I said, they're not locked there. It's they'll try and keep them there, but there's no guarantee. So
yes,
I guess we'll work with it.
That's really accurate. And obviously, you know, the law enforcement is aware, at least to some extent at this point in time, that if it isn't a 12-hour hold, the facility is open. There's a back phone line for law enforcement and first responders at this point to call. And as I had shared, the admission streamlining process, and I can go into that a little bit, this is aside from 12-hour law enforcement holds, that we want to make that as streamlined as possible for law enforcement, first responders. And so far, that whole process has been working. So I can run through that real quickly of the information that I have of their streamlined process, which did go in place mid-May. And we're seeing some uptick in admission numbers. So I am hoping that that's causative in nature, and that we continue to see that.
I don't think I need that unless somebody else does. I've talked to Jason Gum, and he's been involved in that. So I know previously law enforcement hadn't utilized the facility a lot just because it didn't meet our needs. But that is changing a little bit. So through our Field Operations Bureau and our behavioral health deputies, we will continue to kind of educate our folks that this is a resource that they can use for diversion.
I'll take responsibility, Doug, to share, you know, just a single sheet of the updated information just in that regard as I collect it. So you have something, you know, specifically to be able to provide to the deputies and other staff that you're working with.
Okay, that'd be great.
Mike?
Yeah, this is good news, Perry. I'll get out those previous protocols and dust them off and refine them a little bit, because I can imagine, you know, well, some of the EMS folks may not like me saying this. Sometimes, you know, it's just easier and nicer to go for a ride in the back of an ambulance, especially if the patient's willing and able. So we can help law enforcement out with a little bit of that too. Because, you know, we do have the same procedure for involves that can go by EMS, obviously just the only place to go to the hospital. So I'll get those out. And actually, this might be a great turning point for the entire facility for EMS being able to divert more into the facility too. So I'll get working on that. I'll get that back out.
Fantastic. Well, at least from my perspective, I do like the fact that the providers do receive funding, obviously through Medicaid, that sort of thing, for those individuals that are admitted. And there's additional funding, as I mentioned, in regard to this particular, the law enforcement holds as well to facilitate that. So it feels like from a business standpoint, the motivation is in the right place. And I'm seeing both Pioneer Human Services and Compass Health make real efforts, particularly with just some of the challenges that we've faced, everybody knows, over the last couple of years, and that has also affected workforce. So I have high hopes, and we'll continue to work with Elise Simmons and probably Amy Pereira, who is one of the Compass Health directors as well. And am working at just not losing that communication and contact now that Brandon is going to leave. So thanks, Mike.
Yeah,
Very
and just on a side note, EMS can get reimbursement for those transports too under that protocol with the healthcare. So it's just a different coding, but yeah, we can get reimbursement for that.
Yeah. Jack?
That is good news. I like that. No, I just wanted to say very briefly, Perry, the numbers way back at the beginning of your presentation, let's make sure that's in a report to the task force. I almost think more so than the minutes. I think that's information the entire task force really wants to hear. So I'm not quite, I'll talk to Stephen and see how to best disseminate that. Obviously, it'll be in our minutes. Jill alluded to it as well, this idea of capturing the data, but I think that's about the most robust, comprehensive analysis of stuff we've ever seen. So some kind of way of disseminating that to the entire group, I think, is important. Maybe the minutes are the right place. I need to think about it. I'll bring it up at steering, but maybe the first time we'll want you to say it, but I want to make sure the entire task force and maybe even some of the SAC people are hearing these numbers. And it's encouraging under Sheriff Chadwick that law enforcement seems to, they're starting to get that, hey, there's room in the inn.
Right.
That's because that's the goal, Thanks.
Absolutely. And, at this point, one of the things that obviously I wrote up just the information to share with you. I mean, I calculated all of it and wrote that up, and I can provide this information with, just some of the comparisons. It's bullet pointed at this point until we have a more sophisticated method of, reporting out on quarterly basis. The monthly sheets are fairly significant and, somewhat challenging to compare until you actually compile some of the numbers. But
I mean, steering can talk about it. I would think quarterly numbers are fine for this purpose. We're trying to give people a pulse of it, not,
Yep.
Yep.
All right.
And
Well,
Perry,
go ahead, Doug. Yeah.
just real quick, I mean, I think this, and I warned about this, and I think Mike's on the same sheet of music. When it first opened, I'm like, if law enforcement or EMS shows up and they're told either we don't have the staff to take them or it doesn't meet our criteria, they're going to try that once or twice. And if it's not helping them, they're not going to go back and try that. So there's going to be a re-education piece with our folks that, because some of them have just, in their mind, it's like, that's not a facility that really helps us or is an alternative for us at this point. So now that there's some changes, we'll make sure within our field operations bureau that we're getting out to the shift briefings and pushing out information. So no, this is a resource that hopefully works as intended for diversion and gets people the help that they need. And we move that. So we certainly want to see that the deputies and officers use it.
Yeah, I think that the communication that we've had specifically, with yourself, obviously, Doug, and others in the upper structure of the sheriff's office has been great. And I know that information from Deputy Clicks and Deputy Bauman is certainly embraced by the office as well. Their involvement and interaction with the Response Systems Division, just really great communication, attendance at meetings, a variety of utilization meetings and so forth has been absolutely key. And so I think, I just applaud those efforts and their communication as well.
Well, and I think it'll be better once you get those mental health deputies in the cars with the behavioral health deputies. That just kind of solidifies that relationship right there.
Yep. And the contract for our co-responders personnel is in front of county council this 26th, I think it is. And so we are prepared to post those positions and get moving on that too. So some great things that are coming together in terms of that coordination.
Yeah, Barry, and just one point, I'm sorry. That would be the entry point even for EMS, right? So from the new DCRs that'll be working out there and those teams, if somebody wants EMS or transport, they would be sort of making that decision. The officer draws up that paperwork. Yeah, and if there's a need for a ride laying down, that would be preset by the officer or the DCR that's actually going to make that admit. And then for EMS, that's great. We'll take them on over because it's no question for them to get in and drop them off quickly. So I'll kind of design a protocol around that, that the DCR would be sort of making those arrangements, or the officer, that's out there, dealing with the patient.
Yeah, the timing is really coming together because folks are aware that on the 16th of July, 988 was implemented. Call numbers are up. I've been communicating with Volunteers of America, which is our communication and contact arena for the North Sound behavioral health. And actually I'm in pretty close communication with Hannah Fisk. She's the director of the Mobile Crisis Outreach Team, our DCRs. And they have noted a significant uptick in calls. Partially probably because of 988 implementation, but there's some great and very sophisticated communication that's going on there. So we may very well see, increases just across the board in that. One of the things that I do want to touch base on just real quickly is the Compass Health admission streamlining that they implemented in May. Basically what they did was went to staff and did some very significant training, again, reiterating the importance and significance of law enforcement and first responder referrals. And this is what it was oriented towards, but it was not limited to law enforcement and first responder. But it was oriented towards just streamlining the admission process and just super generally, basically they found that the information that they were trying to gather at the point of admission was more excessive than was really needed, that they could gather some of that information later and that they could speed up and streamline the admission process by asking the basic information that they needed to get. As far as the LE and first responders calls, basically 5 questions. Is the individual a sex offender? If they have a blood alcohol level, is it under 0.25? Are they over 18 years of age? Are there no emergent medical issues? And are they able to emulate, their activities of daily living skills? And if the answers are not exclusionary to that, they're like, bring them in, we'll admit them. There's a bed available. And it's a very short phone call at that point in time. And they're, ready and expecting that. Essentially a no decline program. All referrals that are not excluded, as I mentioned, are admitted at that point in time. And then the facility decides, hey, if we do find that there's a primary medical issue that needs to be addressed, we can get that individual to where they need to be, and that the providers take responsibility to get that person transported or whatever needs to happen at that point. All denials are reviewed by the manager, and then any denial cases are also reviewed by the Compass Health leadership. So I'm pretty happy with that at this point, getting the message and essentially across to the providers that this is absolutely a priority, and also that they've gotten that information and the protocol and procedure implemented as far as their staff. So that's good forward movement. It's a little like moving a mountain, interestingly enough, but yes, Jack?
Just letting you know, I got it dug out. I'm sorry. I apologize.
Absolutely.
I will be in trouble if I don't.
That was
right.
the key information. So we got it in there. Thanks, Jack.
Great report, Perry. And we'll figure out how to best share that at the full task force. I don't know what that is. I just know we want to get that information to them easily. And I'd say don't drive yourself crazy figuring that out. And I think every 3 months will probably be enough, but I'm sure steering committee will have some ideas.
Fantastic. Let me know.
Thanks a lot. Thanks, everyone.
All right.
Good luck with your meeting, Mike. Stay cool.
Thanks much. Actually, I'm going to the fire chiefs meeting here in just a few seconds. Perry, is it okay if I just give a high level brief that, because the fire chiefs have been interested in diversion, but I've been holding them off. So I could let them know that they got the certification that over the next couple of months we'll sort of work on that diversion protocol and ease back into that conversation.
Perfect, Mike. And I will make sure that obviously that I CC you when I'm sending information to Doug, just to, to disseminate so that communication is really, really clear. Like I said, it's a real disappointment for me that my primary, communication point is going to be leaving, but I do have pretty good relationships with the upper structure of Compass Health as well. And it's like, listen, folks, we're on a great trend. The numbers are coming up. I don't want to lose the momentum on that. And I don't want to impact the relationships with law enforcement and first responders. So what are we going to do? And so I think that they will hear me, in that regard. So that'd be great, Mike. Perfect. Doug?
Just I'm glad that we're finally getting to a staffing level that we can, fully utilize that facility. I'm also hearing that there's another 32 bed facility, like right in that general area. Is that something that's on the horizon?
Well, there's been a couple of discussions, so I'm not absolutely certain. Are you talking about out on that campus, Doug? Is that what you're thinking, or
either there? Or I'm thinking maybe they're. See, Mike, the other end of the. I don't know if they're thinking the old triage center, or I've heard. I think it was Representative Rule in a meeting talk about some state funding for another 32 bed facility. I'm just kind of curious, one with the workforce issues, right, and then what exactly that's going to be doing.
And forgive me for not having great detail to this. I know that in Skagit County that there has been extensive discussion of a 32 bed facility, some challenges there just in terms of locations and that sort of thing. So I know that that's been one part of the discussion, and I believe that there were some legislative funds that were oriented towards that. But forgive me, I won't swear to that, but that's some of the information that I have had as well. And so there's also, I know I recently saw funding that has come available through the state, through the healthcare authority, relative to crisis stabilization centers, and that kind of a location for both commerce. They usually, have it in terms of the actual building itself. The challenge, of course, has been being able to staff and being able to fund the staffing. The other thing that has occurred with that is that there's been some adjustments to the Medicaid reimbursement, which has been pretty significant help, because essentially when you sharpened the pencil and got down to the math, that the cost of providing the service, because of course it's a 24/7 service that you're providing, not when an individual needs the crisis stabilization center or something of that nature, they need it. It's not a 9 to 5 or whatever, and so the cost for the providers is pretty significant there. So that adjustment to Medicaid funding has been pretty important as well. So I'll do a little bit of research on that, because I definitely looked at a facility that was in Skagit County that they had identified a location or property relative to that, and it was going to be a 32 bed facility, and that's driven by Medicaid, that you can't have more than 16 beds. And so it was, if I recall correctly, the same design of substance use disorder detox, as well as mental health triage, that was going to be for that location. But it was at least a couple of months ago that I took a look at that, and it was not finalized at that point. The dollars were, but the actual facility itself was not. And so I need to jump back into that and take a look at it, because I know that those questions are obviously going to come up. So it is, and actually it's true for our crisis stabilization center as well. This is considered a regional center, which a lot of times, raises concerns for folks in terms of, well, is Snohomish County, or whatever, going to use, our facility, and usually transport's an issue. They do have facilities in their own locations, but because of the way that the funding actually came through, it was actually considered a north-sound region, funding. So I'm sure that that will be the same for the one that we're talking about that I think is located down in Skagit. But transport obviously becomes an issue and a challenge of, okay, so how do we do that? I know that talking with Joe Frank, sometimes that he's actually used the Skagit County detox facility when was, facing challenges and experiences with the facility here. The detox facility has tended to be filled at times, and people have brought that particular challenge up and said, well, what do we do, if we're at max capacity? And I said, well, I'd love to have that problem to deal with, and I'll burn that bridge when I get to it, if we run into that particular piece. But I think that that's going to be an important consideration for the future. So I'll do a little bit more research on the current aspect of that, but I'm pretty sure that that we're talking about the same facility that's actually located in Skagit County.
Okay. Yeah, no, I just like clarification, because like I said, I've heard it in 2 meetings mentioned, and I thought it was in Bellingham in that general Iron Gate area. So
I was going to talk with you just a little bit about that we had made some considerations for the possibility of building out the old triage facility. Obviously, the location and so forth of it. And there's still some discussions, in that regard about the possibility of that being, but it certainly wasn't a 32-bed facility, is why I believe we're talking about another one. But there's been a couple of different discussions and considerations relative to the alternative response team, as well as the co-responders program, just having offices there. And then possibly there was some discussion around what they refer to as a 23-hour facility that is a kind of more of a drop-in for individuals that for one reason or another are not appropriate or not open to going into the crisis stabilization center. That hasn't come to fruition necessarily, but it is in discussion, as that is a model that's been in place in some other locations of where they essentially have what they refer to as 23-hour chairs. And again, this is sort of getting into that whole process of admission for Medicaid reimbursement and the facility and et cetera. And so part of this has been staffing. Obviously they talked about sort of developing this and having peers as a component of it, which I think is a fine idea, as long as you also have some skilled, individuals there in terms of EMTs, and that sort of thing, and also using it to office some of our, alternative response and the mental health professionals and certainly others. So there's been it's interesting how that facility is that location as it became available, that there were has really ensued a number of different discussions of how to best utilize it because of the amazing location, next to the crisis stabilization center and et cetera. But no final conclusions have occurred at this point. We're talking about using it temporarily just to office the co-responders and possibly Art just to be able to use his office because it's sitting vacant right now. But that wasn't a long-term plan. It's more, I don't know if you've heard, but the health department is going to stack everybody up because they are beginning to do construction work on the State Street facility. And there's several health department staff that are there. So we are all going to move into the Girard Street building, and it's escaping me, the garden room, the building, the civic building. We're going to use one floor of the civic building as well. So apparently we're kind of very, very friendly and very cozy for a period of time until the State Street gets built out, with the way station as being a component of it. And another floor of that also being for, we hope, what I'm understanding is the art team, the response systems division, and that would include the co-responders. So a lot going on, and you know, and hopefully that will meet some of the needs of the community as well. You know,
I completely understand the lack of space. I've got staff in closets here.
yes,
Storage rooms.
I think I had shared with you that I I contracted with Department of Corrections for a period of time, and I did have my office in a cell at one point, and so and felt pretty good about that. But the office that I have now that I'm losing because of our move is the nicest office that I've had in my career. But I figure I don't spend all that much time there. It's more out in the community that it's going to be better. So. So I will take responsibility to continue to update you, Doug. Super important relationship, and I've really appreciated the relationship with you and Chief Jones and you know and Jason Gum, and just everybody has just been amazing and in their communication and connection. So I will make certain that you guys know everything that I know about the Crisis Stabilization Centers for our success.
Okay, no, we appreciate that. It's definitely a team effort.
Absolutely. So, well, unless there are others, Jill, I know that we will have an opportunity to ask for public comment. Can we do that at this point, Jill, even though we're 15 minutes early?
We can. Our only attendee is Jackie. Jackie, if you'd like to speak to Perry or Doug, please virtually raise your hand. Jackie Mitchell. Oh, she is raising her hand. Go ahead, Jackie.
Yeah, but I don't actually have anything to say. I just want to say hi. So.
Good morning.
Hi, Jackie.
Hello, Perry. Sorry you had to come back from vacation.
All right, I'm gonna, since we've lost our quorum, I'm gonna stop the recording, but you guys can go ahead and continue speaking.
Chat. We can chat. Yes.